Welcome to our Wellness Wednesday Health Show. I'm your host, Dr. Kala Hewlett from the Back Pain and Joint Center of Texas, where we specialize in taking care of back pain and joint pain, but we do it without prescription medication and we do it without surgery. And so the purpose of the show is to introduce you to healthcare professionals in the community who are also dedicated to helping people improve their health in a more functional way. And so today I have a special guest, Dr. Wendy Shi from Living Breath Acupuncture. Dr. Wendy, thank you for being here with us.
Thank you for having me here.
Now, a lot of people have heard of acupuncture, but very few people that I've talked to have actually experienced it. So, how would you explain acupuncture to maybe a new client that comes to see you?
Well, acupuncture has been practiced for thousands of years, and we use acupuncture to treat various, almost all the issues, and the pains, and then the fever, after the stroke, all those kind of illnesses.
Mm-hmm.
Yeah.
You know, you mentioned something that it's been around for thousands of years. I'll talk to some people and they're like, "Oh, acupuncture, it's alternative, it's complementary, it's different." And I always tell people it's been around for thousands of years.
Yes.
Modern medicine, as we know it, has only been around for maybe 10, 20, 30, 40 years, a very short period of time.
Yes.
And so acupuncture has what I called stood the test of time, meaning for hundreds and thousands of years, it's been helping people even before we had medications, as we know it today.
Yeah.
So how did you first get introduced into the field of acupuncture?
Very good question. Yes, I come to know acupuncture a long way. Actually, I was raised in a doctor's family, so my mom is a gynecologist. And so I surrounded with traditional doctors all the time.
Okay.
But the first time I have encountered acupuncture treatment is in South Korea when I twisted my ankle. And the acupuncturist treated me, and I immediately be able to walk out of the door immediately.
How old were you when that happened?
That was when I was in my 30s.
So in your 30s, twisted your ankle. Was it swollen?
Yes.
Could you put any weight on it?
No. I
So-
hopped in.
So swollen ankle, couldn't put any weight on it. And if
Within
that were,
the treatment, about 50 minutes, and I walked out.
you walked out of there. Now
Yes.
that's almost unheard of, because if that happens nowadays, like if a sports trainer, for example, they'd say, put ice on it, let it rest, it'll take a couple weeks.
Yeah,
Right.
I was amazed. So she actually, the acupuncturist was surprised. And she said, "You are Chinese, but you don't know the acupuncture." I really thought I have something that I missed. So when I repatriated back from South Korea back to the US, and I found acupuncture college. So I went, spent 6 years, get my master's degrees, and I had my license.
Okay, so a master's degree.
Yes,
So for the field of acupuncture, this is a several years of study.
yes,
Okay.
it is. We have few thousand of years, few thousand of hours training. Yes.
Okay. So you have a master's degree in
Yes.
acupuncture.
Yes.
What did your family think about that? That were more of the mainstream medical, like the gynecologists and so forth. Were they in favor of it? Were they not so sure?
I think they know it's a work, but mainly is they just, they always think the Western medicine is a little bit better than the traditional medicine. Yes, yeah.
Okay, very good. Now, looking back to that experience with the ankle, because that's just those amazing healing stories, right?
Yes.
That's what acupuncture is doing, that for thousands of years.
Yes.
What was it that the acupuncture did to help it? So looking back with your knowledge now, your ankle was swollen, there was something out of balance, there was
Yes.
something injured,
Yeah.
so your body started to compensate and it wouldn't allow you to put weight on it.
Yeah.
How did the acupuncture help to rebalance and allow the muscles to, what I call, be turned back on? How does that work?
Yeah, actually, during my practice in my clinic, there's a lot of patients. When you do the acupuncture right, when you find a right acupuncturist, you can see the swelling swollen is reduced immediately. Yeah, you can see within a second.
That's
and
amazing.
you will see, yeah, it is so amazing. So there's a lot of times the patient told me, "You're amazing." I said, "It's not me amazing. It's the acupuncture. Yeah, we just discover it. And it's how it works." Yeah.
Now, some people may have heard the term acupuncture meridians or channels. What are those in the body?
Yes, the acupuncture, actually we do say in the bodies have a lot of meridians, and they categorize as each kind of organs that they occupy one of the meridians.
Okay.
So there's 12 meridians, and then there's other 2 extra meridians, mostly governing the body.
So every organ would be filtered into one of those 12 meridians.
Yes.
Okay.
Yeah.
And then do the meridians run from head to toe, or how do they flow?
It's, all the different meridians flow differently. Some is from head to hand, and sometimes it's from head to toe. So just a different meridian, they travel into a different path. So that is the map that is helping me to diagnose what kind of illnesses is you have. So sometimes the manifestations at your body, the pains, sometimes to me is with a special meanings. It's sometimes it's referral. Some of your internal organs have some issue. So and then that's how I form my treatment strategy.
I love it because I used the term before in a previous interview, health detective, and you're a health detective where if there's imbalances in the body, there's different symptoms. One doctor may look at it this way through x-rays or through blood test, but through acupuncture, you look at it through the meridians of the body and identify what's out of balance.
Yes.
Why is the symptom there? What is the body trying to communicate?
You have
and
absolutely
then
right.
Through acupuncture, helping to, would rebalance be the proper term? Rebalance the meridians?
Rebalance. Yes, that's a right way of using it. Actually, before I became an acupuncturist, I am trained as an automation engineer.
Okay.
So in my previous work, there's a lot of time I do a detective, but it's one is to the machines, and now I detect for the patient. So when the patient come into me, when they first come in, and I will see the gait, how they work and how they speak, what kind of voice, and what kind of smell, and what kind of eye, the complexions. They all tell me the story. So before they started to talk, I almost diagnosis half of my job is done. And then when they talk about their symptoms, and then I make a few inquiries. So those kind of diagnosis is real time. It's unlike the other traditional medicines that you need to wait for days, for months to get the result to come back. So that's why I be able to resolve the issue very quickly.
What are some of the most common things that you see in your practice that you're able to help?
I think majority, the pain actually can help very fast because the patient like it. Because when they come in with the pain, after you doing the acupuncture treatment, the pain is gone or reduced. So they very much convinced this is working.
Helps. Now, depending on the condition and the imbalance, is it one session or sometimes may it require multiple sessions?
I think it depends on what kind of conditions, and also depends on the constitution of the patient. So normally the stronger patient, the younger patients, they have a much faster recovery rate than a little bit elder and a little bit weak patient. They need more treatment.
That makes sense.
Yeah.
So pain, what are some of the other things that you've been able to help and you see?
The pains, and especially sometimes with the anxieties and the depressions, and then the infertility. That's another big one. I have a lot. 3 babies was born in my clinic.
Okay,
so
very neat. So it sounds like from Eastern medicine perspective, those conditions you describe, anxiety, depression, those are more symptoms, and when you identify those imbalance in the meridians, rebalance them.
Yeah.
And so when you use the acupuncture, I've had acupuncturists once in my life. It was many years ago. It was a good experience. But the needles are very gentle. So some people may watch and they're thinking, oh my gosh, all these needles in my skin. So will you talk a little bit about the needles? How deep do they actually go?
Okay.
Do people bleed when you do acupuncture? Because someone
question.
may be thinking that as they're watching this.
Good question. Yes, and actually, a lot of time the people talking about the needles, they think about the syringe needles, but actually our needles is just as thinner as a hair, so you normally cannot be able to feel it. But the needle, the where you put it, and then the depth of it, and then the manipulation, where you turn and where you point it to, that is a skill of art.
That's a skill.
Yeah,
Okay.
that's distinguish the good acupuncture and the normal ones.
Okay, very good. So no large needles like an injection, no blood. It is very, very thin. So it's more about stimulating. It sounds like the acupuncturers help stimulate, and when you identify and turn it in the right direction, or depending on the depth, then you can help rebalance.
Yes, you think about the river, okay, the body, the meridians. There's a lot of energies and there's a lot of nutrients. And then the blood, they just, all the fluid, they move around the body. And for the acupuncture, that for me is I can put into the specific point as a pivot point, that to make that all that fluid change in the direction.
So almost like 12 different meridians, but 12 different rivers flowing through the body, rivers of energy.
Exactly. That's a main one. Okay. And then just like, like you have an ocean, you have a river, you have a stream. So there's a lot of different layers, and then there's a lot of different things I can work on.
Okay.
So that is how you see. The reason why I be able to describe so much is because that after I had my acupuncture training in the US, and I have a chance to work in Singapore for 4 years, so I be able to see all the other alternative treatment. Some of it is like a biofeedback, and then there's a lot of I met some German doctors who use a meridian to treat. So for them, they go back to acupuncture again. So they say, oh, this is the theory in the acupuncture that we learned, and
now,
they use those energy medicine.
Now I've heard that in some Eastern countries that acupuncture, they're actually in some of the hospital systems. Is that correct?
Yes, it is. So for in China, that normally you will have a inpatient ward as use a Western medicine, and then one is with traditional Chinese medicine and acupuncture. There's some specific illnesses they prefer, because the acupuncture treatment, they are better, especially for like if you have a stroke. After the stroke, if you be able to access to the acupuncture treatment, within 2 weeks,
Okay.
about 90%, you'll be able to
goodness.
regain the full body function if you be able to early enough.
And helping to
But
restore the rivers, the energy rivers, and so their body can repair and heal.
because all those kind of stroke is one of the sudden that is being obstructed, right?
So
but the whole function is still working if you be able to remove those obstructions. They be able to regain the
So in my mind, it's like there's 12 rivers flowing through the body. I know there's more. There's rivers and streams. And if a tree falls down and it blocks the river, now it doesn't flow.
Very good.
And there's a problem. And that can manifest itself as different symptoms and diseases and diagnoses.
Very good.
What I think is really neat, how you mentioned, is that they have Western medicine and Eastern medicine all in the same hospital. And they found, depending on the condition, that at a hospital and major medical systems over there, that you'll get one or the other.
Yes.
I think that is just tremendous, because that's something here, it seems we focus so much on one, and there's value on both. Sometimes you need the medication, sometimes you need the surgery, but sometimes you don't need the medication, sometimes you don't need the surgery.
Yes.
And so it seems like here we don't have a good balance. It seems like we're very, very heavy into the pharmaceuticals here. And in fact, we take over 50% of the pharmaceuticals in the world we consume in this country.
I think I lived in the England, and I lived in South Korea, and lived in Singapore. I lived in China. So for me, I see how there's different medical systems play, and how the resources, medical resources, was being distributed. But I think in the U.S. that you spend a lot of money, but the result is not really significantly more than other people and other country with spend a little bit less money. Yes, yeah. But there's a gap.
It's not either or. So many times people think, well, I have to choose chiropractic or surgery, or I have to choose acupuncture or my medical doctor. You can choose both. I think that's the understanding that they work together,
yes.
Not separately.
No.
And as more healthcare professionals of different disciplines, of non-surgical treatments, of acupuncture, of
yes.
chiropractic, of regenerative medicine,
yeah.
of all these different disciplines, as they work together, I think really the patient is ultimately the one who wins out the most. So,
I think so.
Thank you so much for sharing that today. Very, very
Thank
interesting.
Thank
now,
you.
Dr. Shi, if somebody wants to connect with you, is the best way through the phone number or through your website?
The website at livingbreathcliniccom, and also the phone numbers at 281-818-9996. That's all can reach us.
Perfect. And we'll put a link on the bottom of this so you can just click and go directly to her website.
Thank you.
Dr. Shi, thank you so much for your time today, and thank you for your passion in helping people in a very unique way to Texas, we'll say. But I think you're doing a tremendous work, and please keep up the good work. As always, we wish you all the best in health, and we'll see you next week.